Good morning. Thank you for being here. Our presenter today is Sparkle from, let me see if I can get it right, the Center for Community Health and Prevention with U of R. So I will let her jump right in to this awesome presentation and take the floor, and you can introduce yourself as well and say anything more that I didn't cover.
Well, thank you all for having me. My name is Sparkle Wells. I am one of the many wonderful staff here at the Center for Community Health and Prevention. I work for two programs here. I work for the Promote Health Prevent Cancer program, which provides nutrition classes and fitness classes to individuals in the community at no cost to them. And I work for the Cancer Service Programs of the Finger Lakes, which is what I'll be doing today, is presenting education to you on cancer and screening and answering any questions you might have about that. So please feel free at any point during the presentation to unmute yourself, ask any questions. If you'd like to type in the chat box, that's fine as well. Please let me know if I'm going too fast or anything like that. I'm more than willing to slow down because sometimes I can't just crank out the information. So thank you again for having me, and I'll get started with the presentation. So today we're going to talk about cancer, and specifically we're going to talk about breast cancer and colorectal cancer. Breast Cancer Awareness Month is in October, and Colorectal Cancer Awareness Month is in March. Around the community, here in Monroe County, we've had a few of the pop-ups of Blow Up Colon that kind of shows you what to look for, well, what it looks like for a doctor when they do a colonoscopy and what kind of things to look for. So cancer is the second leading cause of death among New Yorkers. 2/3 of all cancers can be prevented with screening and healthy lifestyles. We'll talk a little bit about some of the causes of cancer and what screening actually means. So cancer, sorry about that. So cancer is a condition where abnormal cells, they grow out of control in your body and they form masses that may be known as tumors. A lot of people have asked me, well, what causes cancer? And there are many different reasons that cancers can be caused. Some of those reasons can be your age, your race, and your family history. People may have certain risk factors because of their family history. If there has been a family history of cancer, you are more likely to be at risk for cancer. Now, with that being said, there are times where people will have no risk factor at all and still be at risk of cancer. So we are very, very heavy on the promotion of screening. We encourage people to get their screenings regularly at the ages stated, unless there is a risk factor that encourages you to get your screening before the recommended age. So screening just means checking for cancer before there are any symptoms or problems. Screening tests can find cancer early when it may be easier to treat. And screening can prevent cervical and colorectal cancers. In some of our other presentations, we talk about cervical cancer as well. But we will not be talking about that today. But if you do have any questions, please feel free to ask, and maybe we can come back and do another presentation. So we definitely encourage people, even if they don't see symptoms of cancer, to just follow those screening recommendations. Sometimes you can have symptoms that can show that you are at a higher risk of cancer, or that you may have cancer and you just are not aware of it. So definitely connecting with your primary care physician and looking into those things. So we will talk a little bit about breast cancer. Breast cancer, we typically talk about it being particularly in women, but we know with sometimes men can be at risk for breast cancer if they have a lot of tissue in their pectoral area. And we also recognize that there are transgender folks that would be at risk of breast cancer as well. Breast cancer is the type of cancer that starts in your breast, but it can spread to other areas of your body if it is not treated. So some of the risk factors for breast cancer are being a woman, which is typically a risk factor, but again, men can get breast cancer as well, and transgender individuals as well. Getting older, most breast cancer is diagnosed in women ages 50 or older. You should be getting mammograms regularly by the time you're 50, unless there is another risk factor that indicates that you should be getting it before the age of 50. If there's a family history or a personal history of breast cancer, we always encourage you to talk to your family members about their health history. I know that's not always an easy conversation to have, and not always one that people are willing to engage in, but the more you know about your family history, the better you can look at your risk factors for certain things. Hormonal factors can affect your risk for breast cancer. Other risk factors for breast cancer could be never having had a child, giving birth to a first child after the age of 30, having your first menstrual period younger than 12 years old, starting menopause at an age older than 55, and long-term use of hormone replacement therapy. Some other risk factors could be not breastfeeding, drinking alcohol, not getting enough exercise, and exposure to radiation to the chest early on in life. So the screening that's recommended for breast cancer is a mammogram, which is basically an X-ray of the chest. Here you'll see, there we go. You'll see the side view of a mammogram. This is the image that would be produced from having a mammogram. Again, all women over 50 should be getting this breast cancer screening unless their doctor has recommended something else. Very rarely a doctor will recommend an ultrasound instead of a mammogram, but typically a mammogram is a screening. You should be participating in clinical breast exams when you're visiting the doctors. They should be checking your tissue around your breast and under your armpit to see whether there are any lumps or any concerning things that would result in a mammogram. We also encourage people to do self-examinations when they're alone, not exactly to detect breast cancer, but to detect if there's something, a lump or something that does not feel normal or wasn't there before. We have resources available if you would like that show you how to do a self-examination, which includes the armpit as well as the breast area. A mammogram may find signs of cancer before there are any symptoms or problems. Getting mammograms regularly can help find cancer early, which may be easier to treat. The earlier cancer is found, the better the outcomes are for the options to treat that cancer and preventing the spread to other parts of your body. So again, just a friendly reminder, all women ages 50 to 74 should be getting mammograms every 2 years. While New York State's recommendation is 50 to 74, we recognize, again, there may be someone who needs to get a mammogram before the age of 50, or there may be someone over the age of 74 that still needs to participate in mammograms because of their risk. But again, looking at those risk factors of your age, your family history, and just in changes in your body in general. Again, looking to see if there may be any lumps in the breast area, any irritation of breast skin, concerns with pain in the breast or discharge, or anything that does not appear to be normal for you, definitely should result in a call to your doctor or a medical professional just to get yourself checked out. It could be something else, but again, assessing the risk before it becomes cancer gives you a better health outcome. Okay. So we will talk a little bit about colon cancer. So with colon cancer, this is one of the leading cancers in New York State. This cancer starts in the colon or rectum area, which is part of the digestive tract. Colon cancer can be present in both men and women. So with most cases of colon cancer, it starts with growths called polyps. And over time, those polyps can become cancerous. So we encourage colon cancer screenings. There's a little bit of noise outside for construction, so I do apologize if you hear beeping or things being dropped. I'm not sure if it picks up, but it's a little distracting. But with your colonoscopy, finding and removing polyps can prevent colon cancer. So 9 out of 10 colon cancers happen in people ages 45 or older. Prior to this year, the New York State recommendation for screening was 50 years old. But with their recent data from colonoscopies and people willing to give information about colon cancer, they changed the age to 45 because they recognized that it was, occurring in individuals younger than 50. If you have a personal or a family history of colon polyps, colon cancer, or other bowel disease, you are at risk for colon cancer. There is something in the chat, so I'm going to take just a second to read that. Yes, Francine says that she'd like to share that she has a close friend who was a male with breast cancer. And though it's not common in males, it is something that can occur in males. New York State is actually in the process of revamping our presentations, and I do believe that that information will be included in the new presentations, including information geared towards the LGBTQ+ community as well. Thank you, Francine. So yes, so people with family history of colon polyps, colon cancer, or other bowel diseases really should be getting their screenings as scheduled. And when we mean other bowel diseases, an example can be irritable bowel syndrome or Crohn's disease can put you at a higher risk for colon cancer. Some of the lifestyle factors that can affect your risk for colon cancer are obesity, drinking alcohol excessively, tobacco use, not exercising enough, eating red and processed meats. Those will definitely increase your risk for colon cancer. So a screening for colon cancer, there are a couple of them. So there's a take-home fecal test, which our program uses the FIT test. And I did not bring my FIT test into the room with me, but I can walk you through what that process looks like. A sigmoidoscopy and a colonoscopy. You may see on TV more recently the Cologuard kits being advertised. That is at-home fecal test. That is a test that would be done once a year just to see if there was any blood in your stool. Now with a FIT test, you're not actually collecting stool samples. Again, I'll walk you through that process in just a second. With a sigmoidoscopy, it allows your doctor to check your rectum and lower part of your colon for polyps using a thin, flexible, lighted tool. To prepare for the test, you have to follow a special diet, drink clear liquids to clear out your colon, and that test will be done every 5 years. The most common test is a colonoscopy, which is similar to a sigmoidoscopy, except the doctor uses a longer, thinner tube to check for polyps inside, your colon and rectum. And the way you prepare for this test is, again, similar to the sigmoidoscopy, but it's a little more intensive. Any questions about what a colonoscopy or a FIT test looks like? So again, these are the typical FIT tests. We typically use this one here. Oh, sorry about that. We typically use this one here. It comes in an envelope and it comes with 2 brushes in it. And basically, when you have a bowel movement, what you would do is take the brushes and you would not collect the stool, but swirl it around the stool in the water, and then make sure that the water from the brush gets put inside this pamphlet here. You would close that pamphlet and send it back in a sealed envelope, and then a laboratory would test it to see if there was any blood in your stool. The Cologuard test is the more popular test at the moment for people with insurance. So that's something you may see around a little bit frequently. Okay. So all men and women ages 45 to 75 should be screened for colon cancer. Men and women at high risk may need to start screening earlier. I did work with an individual earlier this year that started getting their colonoscopies at 35 because there was a family history. He had his father had colorectal cancer and his uncles. So because of his high risk, they've started screening him a little bit earlier. Your return for your screening really depends on what they find during your colonoscopy. He's been fortunate enough to only have to go every 5 years because they didn't find anything in his screening. But if that should change, it may be every 3 years, it may be once a year. I have also worked with individuals who are only screened every 10 years.
Sparkle, I have a question about the family history thing. How far back should you be concerned about, say somebody's great grandfather had it or great grandmother had a cancer, but it hasn't been through the generations closer to them? How far back do you need to worry about somebody having a history?
We typically go back to the grandparents in our familial chart. But again, it's if you like had a great grandfather who had it, but your grandfather didn't have it and your dad didn't have it, yes, your risk is higher, but it may not be as high as someone whose grandparents and uncles and father, like it's more predominant in their family genetics.
Okay. Thank you.
No. Okay, so to help lower your risk of cancer, we just encourage you not to use tobacco, to eat a healthy diet, only drink alcohol in moderation, and maintain a healthy weight. Staying up to date with your vaccines, getting regular cancer screenings, um, uh, making sure that you are going to your primary care physician and responding to them when they connect with you to schedule those screenings. Um, in the past, we have really had to work hard to track down certain individuals to get them to participate in colonoscopies. Especially in men, it's very hard to get them to participate in colonoscopies. Um, Nearly 20% of all cancer cases are really, it's because of a poor diet, a lack of physical activity, excess alcohol, excess weight, and not participating in screenings. Screenings really, really can help in the preventative aspect. So get your screenings. If you don't mind, I can show you a brief video of the FIT test and what that looks like, should you need to use one. I think it's about 9 minutes, so let me stop sharing here for just a second. And does anyone have any questions while I'm pulling this video up?
We have a few.
Yes.
So, Ernestina, do you want to ask one of yours?
Yes.
Come on, she's gonna come up to the mic. So
Oh.
she's in the back of the room. Go ahead.
Oh, careful. What is more common in the women have a cancer, the women's married or single?
So can you repeat that just a little bit louder? I'm not sure I completely heard the question.
Yes. What is more common in the women's married or single?
Okay, is cancer more common in women that are married or single? Actually, I don't think that's a risk factor that we have assessed. I'm sure there's some data out there somewhere, but for women, they're more likely to be at risk for cancer if they have not given birth to a child, which is quite an interesting statistic to relate to cancer. But from what I could see, more of the risk factors were related to their health, giving birth to a child, and their screening rates versus being married. But I can look into that and see if we can get some data back to you on that.
I will say that Ernestina has a bunch of questions about those sorts of things like demographics and all of that. I'm curious about socioeconomic demographics. Like, are there more risk factors there? I'm sure it depends on the type of cancer or the recovery. So a good question was about the prognosis, sort of the outcomes.
Okay, so let me just pull this up. So, sorry about that. I'm having a little technical difficulty there now. Okay, so with economic status, we do recognize that those people are at a higher risk for cancer because when you think about someone who is living well under income guidelines, and you think about their food choices or their access to healthcare or their ability to even just get to the doctor, even if they have insurance, they're most likely focused on their everyday survival versus getting screenings, eating healthier, working out, those things. So they are at a higher risk. Especially if you don't have access to the things you need to be able to be healthy.
Thank you.
And I will say that in Hispanic and African American communities, the cancer rates are higher. Are there any other questions? Let me just pull this up. Oh, sorry, there's an ad. I just have to get rid of. Okay. Okay. So this is a YouTube video that we typically share. We typically share when we do our community presentations. It comes in Spanish and English. I do believe they are working on translating it into a few other languages, but this basically just tells you how a fit kit works. It's very simple. It's not as complicated as most people will think it is. So after the video, I'll answer some more questions and explain what we do specifically here at the Cancer Services Program.
It's very, very quiet, Sparkle.
It is. Okay, I was just getting ready to ask. Is that better?
A little bit, but it's still really hard to hear.
Okay, let me. Is that better?
Slightly.
I'm so sorry.
I don't know if other classrooms are having a hard time, but I can't hear it at all.
I'm sorry, you said no one can hear it?
I can't hear it at all. I'm not sure how it's working for the classrooms.
Are others in the classrooms able to hear the video?
No, when you share a video, you need to make sure that you select, there's an option to select share sound through the Zoom, if that's helpful.
So let's try this again. Yes, okay, that's what's going on. Thank you.
Didn't
No.
know that either. It's okay.
I just started having this problem and I'm like, what is happening? So thank you for that. Okay, let's try.
Doctor would have explained the various testing
Perfect.
options available to you as part of a program for colorectal cancer screening. This includes annual testing with a fecal immunochemical test, such as Ensure-1, that detects blood in your stool. Having blood in your stool may be a sign of lower gastrointestinal bleeding, which could be associated with a number of medical conditions, including colorectal cancer, iron deficiency anemia, diverticulitis, ulcerative colitis, polyps, or adenomas. Your doctor will be able to explain what the results of your test may mean and whether further tests are required. In this video, we will guide you through the steps necessary to perform the sample collection for the Ensure-1 test. Ensure-1 is a non-invasive test with sample collection performed in the privacy of your home following a single bowel movement. Unlike other fecal immunochemical tests, Ensure-1 uses a sample of water collected from the toilet bowl at the time of your bowel movement. It does not require you to collect the stool in a sling or bucket or require you to take a fecal sample. Ensure-1 is also not affected by any foods or medications, so you may continue to eat normally and take all your medications without any restrictions or alterations. Before performing the test, we recommend that you carefully review all enclosed patient information for detailed instructions, storage conditions, and other precautions. For accurate results, do not perform this test if you have bleeding hemorrhoids or piles, blood in the urine, or if blood is visible in the toilet bowl, during or within 3 days of menstruation, or if you have bleeding cuts or wounds on your hands. Your doctor can advise you if you have questions about these conditions. Also, do not perform the test if the test card is expired, or if the test kit components are damaged, or if the toilet uses salt water, or the water in the toilet is rusty. Now, let's look at the contents of the collection kit. The kit contains a test card, 2 blue brushes, 2 blue plastic waste bags, instructions, and a reply envelope. When you're ready for your bowel movement, bring all contents into the bathroom. Before you begin, it's important to remove any cleaners or bluing agents from your toilet. Simply remove any cleaning dispensers and flush the toilet twice. Now you're ready to collect the sample for your test. After your bowel movement, place the used toilet paper in one of the blue bags provided. Do not put the used toilet paper in the toilet bowl, and do not flush the toilet. Next, on the test card, lift the flap to uncover 2 small white squares. Set the card aside. Using one of the long blue brushes, gently brush the surface of the stool for about 5 seconds. If the stool is loose, simply stir the water around the stool. Remove the brush from the water and gently shake it once to remove excess water and any loose stool. Transfer the water sample by gently dabbing the brush bristles onto one of the small white squares found under the flap on the test card for about 5 seconds. Remember, only a water sample is required for Ensure One. You want to avoid putting feces on the white square. Some staining of the white square may occur, and this is normal. Put the used brush in a blue waste bag. Using the second blue brush provided, collect a second water sample from the toilet bowl by repeating the same process and gently dabbing the second small white square. Put the used brush in a blue waste bag and dispose of both bags in your regular household trash. Clearly print your name, date of birth, and date the sample was collected on the label located on the instructions for use or information form. Use the label to close and reseal the flap over your sample. Place the test card in the return envelope along with any completed forms requested by your physician. Return this envelope to the laboratory or medical professional as soon as possible, as the test must be developed no later than 14 days after your sample is collected. Congratulations! You have now completed the sample collection for the Ensure One test. The laboratory will process your test card and will advise your doctor of the results. Ensure One detects blood in your stool. There are many gastrointestinal conditions that may cause blood in your stool. This means that if the test is positive, more testing and evaluation by your doctor is necessary. This test does not replace your regular physical or rectal examination by your doctor. A negative test result means that no blood was detected. However, colorectal lesions, including some polyps and colorectal cancers, may bleed intermittently or not at all. Additionally, blood may not be uniformly distributed in or on the stool, and a test result may be negative even when blood or a lower gastrointestinal disease is present. Thank you for choosing Ensure One.
Does anyone have any questions about the FIT kit and how to use them? Okay, so here at the Cancer Services program, what we do is we provide education to the community regarding breast cancer, cervical cancer, and colorectal cancer. We also work with individuals who are uninsured to pay for their screenings for breast cancer, colorectal, and cervical cancer. So if you or someone you know is an uninsured individual, you can connect with us. We will do an intake and we will either work with your primary care physician or we will connect you with one so that we can get you scheduled for the proper exam that you need to have.
How do they reach out? How would somebody reach out to you to connect, I guess?
Awesome. So our so this is our direct number to our office. And this is the New York State website. We are often in the community. I believe we will be at the Puerto Rican Festival. I believe there's an African festival happening that we will be at. We're typically in Greece Ridge Mall on Tuesdays from 12 to 3 p.m. at the Wilmot Cancer Institute kiosk. We are throughout the whole community. We So I am specifically responsible for Monroe County for this program. However, we do work in other counties such as Yates, Wayne, Chemung. Like we work in a variety of counties through the Finger Lakes.
Okay, awesome. Sounds good. Does anybody else have more questions about the video and the test, or anything else from the presentation or about cancer? And I'm assuming that this program does screenings for all types of cancer, not just the two here.
Yes, so we specifically under our grant, we do breast cancer, cervical cancer, and colorectal cancer.
Okay,
There are other programs that do help with that. So if someone calls, we try and connect them to the correct program.
okay, awesome.
All right, we have another question. Go ahead.
Excuse me, I have a question. What's the common cancer on America,
In the United
on
States.
United States?
Oh, I just did an article on this. I would have to look up those numbers through the CDC. I'm really familiar with the numbers for New York State.
What is it for New York State?
For New York State, the second top cancer is colorectal. What was the first one? I think it was lung in association with smoking and vaping.
Lung cancer and, okay, thank you.
Thank you.
Do you see that question in the chat?
Yes. So the fit test, it does not specifically check for stomach cancer, but if there was blood in the stool, we would partner you with one of our gastroenterologists. I hope I said that right. And they would do a colonoscopy that does check most of your GI tract. Yes, we work really closely with the GI department through Wilmot Cancer Institute. And we also partner with Rochester Regional. The beautiful thing about our program is we are under the URMC umbrella, but we are a New York State grant funded program. So we partner with a variety of people. We don't just partner internally. We partner with Elizabeth Wendy, Rochester Regional. There are a couple of like standalone clinics that we partner with as well.
Well, if nobody has any more questions, I guess we can call it good. And I think it was very informative, and hopefully everybody feels inclined to keep watch of risk factors and get screenings when needed. So thank you so much, Sparkle. It was great to connect, and hopefully we can have you here next school year.
Awesome. Thank you so very much. And I look forward